everyone, thanks for joining. We're going to get started now. Just a reminder, 30 minutes, one question, one follow-up. And we have Dr. Yaffe here today, so I'll turn it over to her for some brief remarks.
Thank you very much. Good afternoon, everybody. Today I'm going to be focusing on the numbers over the past weekend, some of the trends in outbreaks, as well as providing Ontarians with some guidance around Halloween. Over the past weekend in Ontario, we had 805 new cases and 10 deaths on Saturday, 658 new cases and 5 deaths on Sunday. Today, we're reporting an increase of 704 new cases and 4 deaths. About 80% of the cases reported over the last few days continue to be concentrated in the health units that are modified stage 2. That is Toronto, Peel, Ottawa, and York. We are very closely monitoring all other regions in the province, particularly those with high and increasing case counts, including Halton Region, Eastern Ontario, and Hamilton. We have 18 new outbreaks today. 13 are in settings such as long-term care homes, retirement homes, and group home settings. Two of the new outbreaks are in schools and 3 are in workplaces. If we look at the weekly trends, there were 117 new outbreaks in the last week, 233 in the last 2 weeks. Overall, while the number of outbreaks continues to go up in the modified stage 2 regions, they continue to be observed more frequently in the adjacent areas. In terms of testing system-wide yesterday, there were almost 32,000 tests completed with a positivity rate of 3.1%. The positivity rate over the weekend was 2.3% on Saturday and 2.5% on Sunday. These data serve as a reminder to follow important public health actions every day in order to protect your health and stop the spread of COVID-19, including limiting trips outside of your home, except for essential purposes. Stay home if you feel ill or if you have symptoms, even if they're mild. Maintain physical distancing of at least 2 meters with those outside your household. Wear a face covering when required and when physical distancing cannot be maintained. And wash your hands thoroughly and regularly. Earlier today, Dr. Williams issued a statement with respect to Halloween, and the Premier reinforced the recommendation at his press conference earlier today. To reiterate, given the high transmission of COVID-19 in the modified stage 2 regions of Ottawa, Peel, Toronto, and York, traditional door-to-door trick-or-treating is not recommended. We're asking that people find alternative ways to celebrate. I know that this will be disappointing for many children, but there are so many things that you can do to have a fun and safe Halloween. You can still dress up, decorate, and carve your pumpkins. And although it is recommended you do not go trick-or-treating, consider a candy hunt with people in your household so you can still enjoy your favorite treats. For those areas of the province that are outside the modified stage 2 regions, you must still take precautions when trick-or-treating. Only go out with members of your household. Only trick-or-treat outside. Both trick-or-treaters and people handing out candy should wear a face covering. And it's important to remember that a costume mask is not a substitute for a face covering. Do not congregate or linger at doorsteps, and remember to line up 2 meters apart if you're waiting. Whether collecting or handing out treats, wash your hands often and thoroughly, or use hand sanitizer. And do not leave treats in a bucket or bowl for children to grab. Consider using tongs or other similar tools to hand out treats. Again, I know this is very disappointing. Certainly not the way we wanted to celebrate Halloween this year. But this is the safest thing to do to help slow the spread of COVID-19. Thank you. Now I'll turn it over to questions.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question, please.
which will be from Melissa Candelaria at Your TV Halton. Please go ahead.
Hi, Doctor. I was wondering, you had a brief mention that you are looking into numbers in Halton region. I know it was alluded to and a bit of a warning last week that it could go into stage 2. So my question is, what are the plans for Halton in terms of going into a modified stage 2? And what is the threshold really in terms of what will enable the government to make a decision to put Halton into stage 2? Is there like a number threshold? Certain cases have to be at a certain number, things like that.
There is no specific number or threshold at which we say, okay, it's over that threshold, we definitely move it to modified stage 2. The public health measures table, which has 6 different medical officers of health and scientific input from Public Health Ontario, laboratories and so on, looks at data for each health unit, including the trend in cases per 100,000 population, the percentage positivity in the lab reports, the capacity of the local public health unit to do case and contact follow-up, and also the capacity of the local health system, the hospitals, ICU beds, hospital beds, and so on. So they look at a bunch of those factors together, and they then make a recommendation that eventually has to be approved by the government. So at this point, I know that Halton is one of the areas being very closely watched, and we'll wait to see what's recommended.
Yeah, I don't know if you can answer this. I was just wondering if you can give us an update in terms of testing at pharmacies. Halton hasn't received any opportunity to have those. Is there any indication as to when pharmacies in Halton might get those?
I know that they are generally expanding pharmacies that are doing testing, and at this point, I'm not sure about Halton, but I can take that back. But there are pharmacies in many areas of Ontario, and they are being expanded. But I can certainly follow up about Halton.
Next question.
Please go ahead.
Hi, Doctor. I just want to ask about Halloween, and I understand the recommendation for the hot zones not to have traditional trick-or-treating, but what if people do want to try this and do it safely? I mean, are you going to do anything to stop it? Are you recommending any deterrents, such as ticketing or fines?
We're not recommending any enforcement or ticketing or fines. It's really a decision of the parents. I think it's important for parents, particularly of younger children, to think about the pros and cons, benefits and risks, and consult your local health department as well, their website, or call their hotline about what advice they are giving locally as well. But if they do decide to go out, then those precautions are extra important in the hot zones. Our recommendation is they not do trick-or-treating outside.
Follow-up?
And on a different topic, I wanted to ask about Toronto Public Health releasing test positivity rates and testing rates by neighborhood today. The data they released originally comes from the province, so will you release that data on a provincial level or at least for other hot zones?
I actually haven't seen that, but I will check into that. I know that we have mandated, I guess now a few months ago, that health units collect data on ethnic background, language spoken, income, and household size, so that we can determine, start to measure the incidence of COVID-19 by those factors. And there's a group of consultants that's meeting this week for the first time to come up with recommendations that will help us to look at that data in a very logical, sensitive manner that will actually give us good data. So we're hoping to have more data on that. Will be specific to data from cases, not just by neighborhood. So any data we have is helpful, but we're hoping to have even better data.
Next question.
From Mike Crawley at CBC News. Please go ahead.
Hi, Dr. Yaffe. Also related to Toronto's high positivity rates in certain neighborhoods, one of the things that Dr. Davila suggested is that there's a need for more testing to happen in some of these particular neighborhoods. What is the province doing to assist in getting more testing happening in Toronto's particularly affected neighborhoods?
Well, we're certainly working closely with Ontario Health and with the health units. And we recognize that some areas need more access to testing, and that the assessment centers and appointment system may not be meeting their needs for accessibility. So more pop-up testing, more communication through the local media, through their own ethnocultural media, more information through social media. But I think there are also a lot of issues around support for those people if they do, in fact, get tested and they need to be off work. So, and in terms of also their household, if they're living in a intergenerational household with lots of different people, it's crowded. Some of them may be older and at risk. So I know Toronto has set up a voluntary isolation facility for people to go to if they can't isolate properly at home. So testing is important, but it's not the only part of the equation.
Follow up?
I also wanted to ask you something about the COVID Alert app. The figures that we have from the province suggest there have been about 1,300 instances in which people have reported their infection through the COVID Alert app. And if you compare that to the number of confirmed cases that there's been in Ontario since the app was launched at the end of July, it actually works out to only about 5%. What does that say to you about the effectiveness of this app in terms of helping with things like contact tracing? And what more could be done to ensure that more people are actually using the app to track their movements and to report when they have a confirmed case?
Well, we really are encouraging people to download the app, and I'm not surprised that the number of downloads is small compared to the number of cases, because last I looked, I think maybe 2 million people in Ontario have downloaded, something like that, out of 14.5 million. So that's promising, but it's not enough. We need more people to download the app. It's a very privacy focused. There's no way that you can be identified. The app basically measures the distance. If you're near somebody else who has the app downloaded on their phone, if you're within 2 meters of that, basically if the two phones are within 2 meters of each other for 15 minutes, it's a signal. But there's no way to tell where you were, who you are. And so it's important to reassure people about that and say that, yes, you have to download the app, otherwise it won't work. But I do want to also reassure you that all the cases that go through that are reported to the local health unit as well. So it's not entirely dependent on that. The other thing is that once it's downloaded, so if you're a case, you put in the number and you download, so the message goes to the contacts. You can also put in online, there's something called Contact Plus, where you can actually put in the information about who you've been near, where you've been in the last 14 days, so that will help the local health unit do their contact follow-up. So there's a lot of good aspects to this app, but it needs to be downloaded.
Next question.
From Cynthia Mulligan at City News.
Hello, Dr. Yaffe.
Hi.
A question, on the positivity rate. I'm trying to get some perspective here on how far the spread is. Because we changed the parameters around testing, and at assessment centers, it's only supposed to be symptomatic people only. Does that lend itself to the positivity rate increasing, or is it truly rising because it's spreading more in the community?
Well, first of all, we have changed the criteria, so you're right, that needs to be taken into account when we look at the data. But assessment centers, so we're saying anyone with symptoms, anybody who's identified as a contact of a case, anybody who's part of an outbreak investigation. So not necessarily everybody would have symptoms, but the majority probably would. So we know that people going to assessment centers, as I said, the most recent data is about 3.1% positive. I also looked at the data from pharmacies, people who are asymptomatic in groups that require testing, for example, people who work at long-term care facilities, people who want to visit their loved ones in long-term care, people who are about to travel, those kind of asymptomatic people that are required to get tested. The positivity rate there is 0.3%. So that is very reassuring. I think, the bottom line is the positivity rate is one of the indicators. It's not the only indicator, but it's going slowly up, and that is a concern.
Follow up?
Okay, thank you. When we get rapid testing, and I know there's no firm date on when that would be, would you recommend that it goes to more vulnerable people? Would you recommend that it's in long-term care first, or that they get a priority?
There are a number of new tests coming out that either have been approved by Health Canada or in different stages of being approved, and I know that they will be coming to Ontario. There is a group of experts, a task force, that's looking at those tests in terms of what is the sensitivity of the test, what are the pros and cons of doing that test, the strengths and weaknesses, and what are the logistics of implementing the test. Some of those tests require, particular equipment that has to be calibrated, and there has to be a technician there, and some of them require that the specimen be sent to a lab afterwards. So it's not quite as simple as a pregnancy test where you bring it home and you just, look at it and it turns a color, although that would be lovely. So we're waiting for the recommendations from the task force. At this point, it looks like with the limitations of the tests, there probably will be recommendations to place them in places either where there's particularly vulnerable populations, like you mentioned, long-term care, or in areas where the turnaround time for test results has been long, in particular due to distance, like the northern remote areas of Ontario. So those are the areas we're looking at, but it's still early days to say exactly how they'll be put out.
Next question.
It's from Randy Rath at CHCH-TV. Please go ahead.
Hi, Doctor.
Hi.
I'm wondering about the mobile COVID center that's at Joseph Brant Hospital in Burlington. When you talk about moving Halton and Hamilton into modified stage 2, is the capacity of that building taken into account?
I'm not sure what that is. That a hospital, part of a hospital, or what is it? I'm not sure.
It's a mobile. It's a giant tent that they set up and turned into a COVID ward when this all started. It's been sitting empty since COVID started.
Okay, I can't speak to that one in particular, but I mean the hospitalization rates for COVID-19 are slowly going up. They haven't hit a serious point where it's impacting on other patients, but that's the concern. And the number of patients in ICUs is slowly going up as well. So, of course, we have the backlog of surgeries and other health conditions from the first wave where everything was shut down. So we're trying to maintain the ability to deal with the backlog as well as treat COVID. So I'm sorry, I can't speak to that specific instance, though.
Follow up?
Yeah, just to follow up on that, we have that center. Is there consideration given to moving, if the hospitals in the hot zones get overwhelmed, moving patients into other areas for treatment?
That would be something that would have to be considered at the time. Right now, we're looking at making sure the hospitals are able to deal with the pressures as they're occurring.
Next question, and this will be the last question.
from Carissa Wilson at CP24. Please go ahead.
Hi, Dr. Yaffe. Thanks for taking my call today.
Hi.
So the first one is just about dance studios. So Minister Lisa McLeod says she's talking with Dr. Williams and the command table to reopen dance studios in hotspots that are in a modified version of Stage 2. She says dance studios should be in line with other sports like swimming and cheerleading that have not been affected by the restrictions. And dance studios say they keep enrollment at a limit, and the classes are the same cohort of children, adults, each time they're in studio. So my question to you, are you in favor of reopening dance studios? And do you know when we can expect an answer on this from the command table?
Well, I mean, I think that the bottom line is the public health measures table is going to be looking at, I understand, at dance studios very soon. I've certainly received a lot of emails and communications from people about the importance of dance studios and how they can maintain the measures that are required. So assuming that those are correct, then I'd be in favor of opening them. But I mean, I think whatever you do, you have to remember that any contact with people that are not in your household, that you can't keep at least 2 meters apart. That's where the concern is. So we'd have to be sure that that would be able to be done. And but certainly physical activity is important. We want kids to get out and do physical activity, not just sit at home. So it's a balance. And I would certainly be in agreement, assuming those conditions can be met.
Follow up, and this is the last question.
Okay, and this question is from my colleague, Chris Fox. So Toronto released neighborhood by neighborhood data, which shows positivity and testing rates. The data continues to show a socioeconomic disparity, with some less affluent neighborhoods reporting higher case volumes and positivity rates. But it also seems to suggest that testing rates are sometimes lower in these hard-hit neighborhoods. For example, in the West Humber Clairville neighborhood in the far northwest corner of the city, the testing rate was 12.2 per 1,000 people. And in the Bridle Path, Sunnybrook, which has a much lower rate of infection, it was 22.9. What do you make of this?
Yeah, as I said earlier, I think there are multiple factors involved in the concerning trend that we're seeing with low socioeconomic status, racialized communities having lower testing rates but higher positivity rates, higher incidence of COVID. So I think that, again, working with Ontario Health and the local health units on pop-up clinics that increase access for testing is important, and we continue to do that, as well as looking at other factors that are involved in terms of the ability for the person to take time off of work if they feel ill, and the ability for them to isolate appropriately if they live in a crowded household, especially with older people. So I know Toronto and Peel have set up temporary voluntary isolation facilities where if that person is willing and the conditions are right, then they can be isolated and away from their household so that they don't infect others. So there are multiple factors involved. Testing is one of them.
Thanks, everyone.